14 early and dangerous signs of diabetes. So let's start with the signs and symptoms. What will you feel? What your body does that could suggest your blood sugar's up. Here, I'll talk about when it's high and when it's really high. There's a difference you'll understand in this vid. First, both type 1 and 2 diabetes can give symptoms. The difference is that in type 1, it happens faster. It's a quicker, more pronounced disease. Why? Because the pancreas stops making insulin. There's an autoimmune attack on the pancreas's beta cells that make insulin. So symptoms might show up quicker. Blood sugar levels spike quicker in type 2 diabetes where there's sometimes too much insulin, but this hormone can't get sugar into cells and muscles. In type 2 diabetes, the majority, about 90 to 95% of cases, the onset will be slower. Classic diabetes signs might not show. Sometimes you might feel nothing. Certain signs could be mistaken for another disease. So it's important to stay aware of early diabetes signs. Let's start with signs and symptoms. Don't let me forget. 5,000 likes so more people have access to this content. We can spread this info given the high number of diabetics and even more pre-diabetics. And about 25% will become diabetic within 5 years. So, early diagnosis is key to health. Number 1, bad breath. But what's breath got to do with diabetes? When blood sugar is really high, what happens? Can't use that sugar for energy because the insulin hormone isn't functioning right. One thing that happens is the production of so-called ketone bodies, which you get rid of when you breathe, so you get bad breath. It's one symptom we say is an early sign of type 1 diabetes, not so much type 2, and I said I'd talk about the difference. So, bad breath usually comes when blood sugar is really high. Mildly elevated blood sugar levels like 130, 135 don't cause this symptom, but yes, bad breath can be a diabetes sign. Number 2, leg burning is the most frequent chronic diabetes complication. Sensitivity changes could mean diabetic neuropathy. Out of 2 diabetics, one might have neuropathy. 50% diabetics, that's millions and millions of folks. So note any burning or change in feeling in your legs and feet. Here, you don't necessarily need super high numbers to get diabetic neuropathy of blood sugar. A minor change over time could mess with your neurons, your sense of touch, and cause burning. And yep, you could get diabetic neuropathy. We've seen it's common, so stay sharp. Number 3, slow healing. When blood sugar increases, some of your cells don't function as well. Among them, cells that are in charge of healing, and also because of blood flow to the site which could get affected. So keep an eye on how long it takes to heal wounds, your healing time. If it's slower than usual, gotta check your blood sugar levels, because it's one of the signs, symptoms of diabetes. Take note of how you heal. A lot of people just ignore it, this signal right here, and waste time discovering the disease early on. In an earlier stage, number 4, libido changes. You guys ask about it a lot. So many comments, if diabetes could change libido, which isn't often mentioned too. And yes, diabetes can cause impotence. In fact, 2 factors here. First one's from changes in the blood vessels, where diabetic can get a disrupted blood supply. So yes. Second reason is high blood sugar levels can mess with the function of the pituitary gland, which makes some hormones like FSH and LH. The last one's for stimulating testosterone production in the balls. So yes, changes in libido and women like menstrual cycle and also libido issues. Guys, impotence. Ladies, changes in menstrual cycle and less libido for both. So look out. Number 5, super thirsty. Why so thirsty? You probably knew this symptom. Why does a diabetic drink tons of water? And this symptom appears when levels are super high, all right? Your body tries to balance it out. Since there's a lot of sugar in the blood, it tries to balance it out by drinking more water. You get thirsty. So if you're drinking more than usual, it might be a symptom, even for type 1 diabetes, okay? Or type 2 diabetes when sugar is high. So it's not just an early sign, but the early sign of type 1 diabetes or a more developed sign of type 2 diabetes. Number 6, extreme hunger. We call it hyperphagia. Why? Because your body can't use food energy, making you hungrier, and this happens whether you eat or not. Like you're still hungry after eating, then might be a sugar imbalance. Number 7, changes in gums and teeth, regular infections, gum bleeding, and periodontitis. Why is that? Because diabetics with periodontitis have a tripled heart disease risk, so dental changes are also key. It can be a diabetes sign. Number 8, recurring urinary infections. Because your body tries to dump sugar in your pee. Your kidneys help to balance your blood sugar and get rid of the sugar. This can make you more prone to urinary infections. I've seen a lot of diabetic patients myself. When I ask about it, many agree they've had recurring urinary infections. I had it many times last year, so watch out. Beyond correct treatment, you gotta check your blood sugar. This often happens when blood sugar levels exceed 180. Your kidneys start this process, so that 130 to 140 range won't cause it, okay? And the higher your blood sugar, the more your kidneys get rid of glucose. So watch out. That's why they say diabetics' urine attracts ants, right? Yes, indeed. It's not a myth, it happens. Ants in the trash, too, could be from pee on papers, and ants in the toilet can mean diabetes, and it's another symptom. Won't count it as one as it's tied to urinary infections, but still watch out. Number 9, fatigue. Over half of diabetics at diagnosis report fatigue, weakness, as your body can't use glucose. You're just not getting enough energy. It can be diabetes along with other diseases, but with diabetes prevalence, always consider it. Number 10, vision changes, blurry vision. 2 reasons can cause this. First is high blood sugar levels damaging your retina, a typical diabetes change called retinopathy. Diabetic, probably you've heard of it, but also when levels are really high in both type 1 and type 2 diabetes, it can blur your vision. So vision changes can be a diabetes sign. Number 11, dark spots and skin folds, also called acanthosis nigricans. Why? Because when we have insulin resistance, a symptom of acanthosis nigricans, it can be a diabetes type 1 or 2 sign, even pre-diabetes. When your body needs to make more insulin to compensate, it can cause these spots. Neck, armpits areas may have these spots, signifying insulin resistance. Number 12, lots of urine. Drink more water. You need to eliminate more fluids, because you'll be drinking loads of water. Look out for nighttime awakenings. It's easier to quantify. You didn't drink water at night, but now you're going bathroom multiple times. Sometimes frequent liquid intake can be harder to notice, like, I'm drinking more water. It's harder, but bathroom trips frequency is easier to notice. So, waking up to pee at night could be a diabetes sign. Number 13, weight changes, losing weight, can't explain why. Started no diet, not controlling calorie intake, but losing weight. It's a diabetes sign, yes. What happens when the level's also higher? It's one of the initial type 1 diabetes symptoms. We see type 1 symptoms occur faster, so pay attention. Type 2 also happens, but sugar levels are a tad higher in the blood. And the 14th sign, skin infections, fungal infections, as higher blood sugar, not necessarily a lot, predisposes to these infections. So if you're getting lots of infections, be aware. Today we reach 500,000 subscribers, 500,000. Thank you deeply. If you made it here and are not subscribed, I invite you to subscribe. Join our group, click subscribe, and enable all alerts as YouTube notifies when I post. Now I'll suggest a video about 7 mandatory tests for all diabetics. Many are unaware. Do you know them? Regardless of your type 1 or type 2, you should know about these tests here. I discuss them in this video. Cheers!